you doing? My name's Gretchen. What's your name?
Kim,
How old are you, Kim?
4055.
Okay. It's nice to meet you. You're here today for a complete head-to-toe assessment. I'm going to be touching some areas, listening to all different areas. It doesn't mean anything's wrong. If you have any pain, if you have any questions, let me know immediately and we'll stop and address it from there.
Okay.
Okay, that's okay?
Yes.
Okay. Right now, we're going to start. I'm also going to be asking you to take a couple of deep breaths at different times.
Okay.
So we're going to go from there. That sounds good?
Sounds good.
Okay, great. Can you tell me what day and month and year it is?
August 6th,
Okay.
2020.
Okay. Okay. Your BMI looks good for your height and your weight. Your posture's good. Your positioning's good. I saw you walk in. You had a good gait. Do you use a walker or cane or anything?
No,
Okay. I don't see any physical deformities. How's your mood right now?
it's good.
Okay, great, great. Is English your first language?
Yes.
Okay, good. You look very clean and dressed appropriately for our assessment. I'm going to take a look at your skin. Hair distribution's good. Your hands and nails are clean. Your skin is warm and dry and pink. I don't see any breaks in skin, bruises, lesions, lumps, bumps, nothing like that. Okay, I'm going to check your pulses. Okay. Okay, I'm going to take a look in your hair. Back up a little bit, baby. Okay, I don't see any lesions or nothing like that in your scalp. Your hair is clean and brown. You can back. Okay, everything looks good. I'm sorry, everything looks symmetrical. We're gonna look at your face real good. Okay. I'm gonna do cranial nerve number 7, which is your facial nerve. So can you puff at your cheeks for me with some air and blow it out for me? And smile and frown. Great, and frown. That's good. You're doing good. You're doing good. Everything looks good. Everything looks symmetrical. I'm gonna check. Okay, next we're gonna do cranial nerve number 5, your trigeminal nerve. Okay. Can you take the chewing for me? Like chewing something? Perfect. Okay. I can feel it on both sides. Okay. We're gonna do your maxillary sinuses. Back up. We're gonna do your sinuses here. Come on this side. I don't see any lumps or scars or bruises. Your pulsations look good. I'm going to palpate your lymph nodes. I'm going to fill in different areas.
Okay.
I'm going to start right here. Preauricular, parotid, tonsillar, submandibular, submental, posterior auricular, occipital, superficial cervical, the deep cervical, posterior cervical, supraclavicular. Now look at the carotid artery. This side, right here. I'm going to listen real quick. Okay, I'm going to do the same thing on this side. Come on this side for me. Okay. I'm looking at cranial nerve number 11, the accessory nerve. Can you move your head around for me? Okay, and up and down. Can you push my hands for me, side to side? No. Now we're going to look at your optic nerve. Okay, everything looks good. Can you hold one hand over your eye for me? And there's going to be a word right there.
Some can.
Perfect. Now your other eye.
Some can.
Now we're going to look at your ocular motor. You turn your eyes up, look down, side to side. Perfect, perfect. Okay, now I'm going to check your sclera. Well, actually your external structures first. Your eyelashes, your eyelids, the crease in your eye. I don't see any drainage, no redness. no discharge. Okay, your conjunctiva, your sclera, your cornea, your irises, brown and white, pink and moist. Again, no redness. Okay, I'm going to shine a light. Can you just look straight ahead for me? Okay, your pupils are equal reactive to light accommodation. I'm going to look at your ears. Do you have any pain or tenderness?
No.
Your ear. Okay. We're going to do the vestibular cochlear nerve, cranial nerve number 8, a little hearing test. If you can put your hand over your ear, I'm going to whisper a word to you.
Welcome.
Perfect. I'm going to do the opposite side.
Welcome.
Perfect. Okay. I'm going to look at your nose. Everything's symmetrical and aligned. No bumps, no bruises, no masses noted. We're going to do radial nerve number 1. Excuse me. Your nerve number 1, olfactory nerve. Can you tell me what you smell?
Bubblegum.
Perfect. I'm going to look at your nose and your septum. Everything's even and aligned. No drainage noted. I'm going to look at your lips. Okay. No break in skin. Can you open up your mouth for me? Your lips and gums look good. No bleeding. Okay. Can you stick your tongue out for me and say ah? Look at your tonsils. No white patches on your tongue. Okay. We're going to do nerves 9 to 10. The pharyngeal and your vagus. Can you swallow for me? Perfect. Now if you can stand up, I'm going to come behind you for me. Remember, we're going to do your thyroid gland. Face this way. Okay. Now if you want to sit down for me, I'm going to take a look at your back. You want to face this way for me?
This way?
Mm-hmm. Okay. Everything looks symmetrical and aligned. No lumps, bruises, or scars. I'm just feeling it right now. See what's going on. I'm going to listen to some different areas of your lungs. Okay, every time you feel my stethoscope, take a deep breath for me.
Okay.
Go ahead, take deep breaths. Okay, we're going to check for some CVA tenderness. Come right here. Okay, take a deep breath for me. Okay, perfect. It expanded out. Very good. Okay. You want to turn back around for me? We're going to take a look at your chest. Okay. I'm going to rub my fingers along your trachea. Okay. I'm going to listen to some areas on your lung real quick. I mean, on your chest.
Okay.
Deep breath for me every time you feel my stethoscope. I'm going to have to move your breast over a little bit. I'm going to come right here underneath this breast. Can you lift up your arm for me? Okay, we're going to do the same thing on this side. Great. I need to listen to your apical pulse. You can put your arm down for me. Okay. I'm just going to palpate it. Okay. Now if you want to lie down for me, I'm going to take a look at your abdomen. Okay. Everything looks good at eye level. Everything is symmetrical. Now I'm going to take a listen. And all quadrants. I'm just gonna palpate on you. If you feel any pain or anything, let me know.
Okay.
Okay, now we're gonna do a little bit deeper palpation. Okay. Any pain or tenderness?
No.